Welcome to another episode of the Housing to Hope podcast, the series where we dive into stories, people, and programs from Atira that are making real change in our communities. Today, we're exploring a powerful initiative that's breaking down barriers and building trust in public health, the Empower Vax Project, also known as the Vaccine Hesitancy Program. Funded by the Public Health Agency of Canada and delivered through the Immunization Partnership, this community-based program focuses on vaccine education, outreach, and support for women who have experienced violence, abuse, or marginalization. What began as a response to the COVID-19 pandemic has since expanded to address a broader range of respiratory illness, all while staying rooted in a peer-led, trauma-informed approach. Today, we will be joined by Chimebere Akinsanmi, the program coordinator for Vaccine Hesitancy, who will tell us more about this meaningful work and the impact it's having. So stay with us. This is a conversation about resilience, trust, and the power of meeting people where they are. Thank you for joining us, Chi.
Thank you for having me.
So, can you start with introducing yourself and walk us through your journey with Atira? How did you start it, and what drew you to this organization and its mission?
Of course. So, my name is Chimebere Akinsanmi. Well, when I started with Atira, I was onu then, so I wasn't married then. So I got married when I was in Atira. But I've been in Atira for about actually about 4 years now. And I started as a support worker in one of the buildings. I started as a casual support worker, learned the ropes, and at some point, I started working full time as a support worker. So that was great, like being in a particular building, getting to build relationships with the women, and not just coming there once in a week or once in 2 weeks when as a casual worker. So it was great to actually build that relationship. I left for a while because I did relocate to Ontario. But when I came back straight to Atira, which was great. Like it was that, and that's one thing I appreciate about Atira, the fact that once you're a staff in Atira, it's it's easy to come back. It feels like family, basically. So even if you leave, somehow you're always on file and they would always want to accept you back. So it was easy for me to get back into the organization. And then I came back again as a support worker in that same building. Um, After a while, I became a community kitchen coordinator because I cook and I love cooking and I love cooking for the women. So I did that for about 1 year. And right now I'm working as a project coordinator for the Vaccine Hesitancy Project. So it's great to see that there's room for growth in Atira. So that has been my journey so far in Atira.
Wonderful. Now, going back to vaccine hesitancy programs, the program that you are leading as
Mhm.
of right now, can you explain to us what makes this program unique? And from your perspective, what makes this approach different from others in the sector?
So firstly, I would say what vaccine hesitancy is basically. It's when I'll give a scenario. You meet somebody and you're trying to explain to them why it's good to have take their vaccines, and especially during the COVID times. And the person is like, I'm not having it. Like, I don't want to get vaccinated. And you're able to probe a little bit like why, what's the problem? Then they tell you like whatever barriers they're having. Maybe they've had issues with the healthcare system before, they don't trust the healthcare system. So those are good reasons, but those are reasons that you can actually solve, right? In Atira, what we do as part of the vaccine hesitancy program is to bring the clinic to the building, bring the clinic to the residents. So we break that barrier of not being able to go because you don't want to see so many healthcare workers or you don't want to be in a hospital setting. So the hesitancy is not totally saying no. It's just there are barriers that are making them say no. And then we can provide solutions, get past those barriers and get to them to a point where they feel vaccine confident. Right. So that's literally what vaccine hesitancy is. So the difference between the vaccine hesitancy program we have in Atira and other places is peer-led. And what do I mean by peer-led? So we bring in our residents people who live in our buildings, who have shown that they can be accountable to other people to work alongside us. The beauty of this is they're speaking to other residents who have been in the same situation with them, who have had misinformation or trust issues with the healthcare systems, than coming from maybe a support worker or me being the project coordinator and telling them like, oh, you have to do this, talking to them about their health, but I maybe haven't received that kind of treatment before, right? Or I don't have a problem with leaving my house and going to the hospital, but maybe this person has some disability that is going to keep them confined to their houses. So it's easier for them to relate to their peers than the message coming from me. So that is one beautiful thing about like how the vaccine hesitancy program works in Atira.
That's actually very important to be able to trust the individuals who are giving those information to you.
Mm-hmm.
And going back to, I know we had that conversation the other day because you were giving me information about the program before we started podcast because I was very curious, and you were explaining how um the program itself, it's more of a resource, right? It's a way for the residents, the community members to know what they can do with that information. Is an education. Whereas, oh, we think you need to do this, or this is what we think you should do. It's this is the information we provide, and that is the message that it carries by the residents or the lived experience or peers, as you mentioned, people who are in the same situation and experience, and that would be easier for others to trust that information and make the
Exactly.
choice easier.
Yes. So
So
they provide the resources, they provide information so the women do not get misinformation. And then one of the other ways that they provide this information is not just going to them with like medical jargon. They actually do community building activities. So there are game nights, there are possible movie nights, there are like activities during the summer. They go for like maybe even with the kids, they go for like something, going to the lake, going for a walk, painting. Art therapy is also done. So all of this builds the relationship between the peers and the residents, so that at some point when the women feel comfortable talking about like their health situation, it's not a stranger talking to them about it. This is somebody that they've done a little bit of life with, right? So that is one of the ways that we actually provide these resources to the women.
that's great. And I know that you briefly touch base on the peers. Who
Mm-hmm.
are the peers? What are the peers program? And it's you are so very involved with that. You work with many peers for many years. And
Mm-hmm.
can you explain a little bit more about the peer program itself? I know the vaccine hesitancy, it's an initiative itself, which includes the peers.
Mm-hmm.
But the peers also, I know we do have peer program across a tier for different programs, but yourself having to work closely with them, with the peers. What are some of your experience? And I know this work that you can do can be really intense, working at the front, meeting with the peers who have lived experience, and providing opportunities for them for peer employment, and then some of the success stories. So, can you share a personal moment of hope or success that reminded you why this work matters?
Okay. So one thing, almost like a mantra you hear in Atira, is we meet the women where they're at, and they're basically the champions of their life and their decisions. So what the beauty of the peer program is, we have to meet these peers where they're at. We want them to have work experience, which is what they're getting, but at the same time, we are shutting down the barriers of, oh, this person is still using. Oh, this person has a disability. Oh, this person maybe is even homeless. We don't care about all of that. We just want to empower these women to get to the point where they feel confident in themselves and know that they can actually add to society. And that is what we're doing, right? So I guess one of the I feel like it's a general success story for a lot of peers I've worked with, because there are some of them I've worked with, and I look at their growth from when they started to where they're at, And personally, sometimes I feel like I don't think I'll be able to do as much as you've done. So I feel empowered even working with the peers. So I can think of a particular peer who I had known from working as a support worker till now that I'm working as a project coordinator. And I love her life story. I love like how when I met her, she was out of addiction already, but I don't know what we are talking about one day, and she just basically told me her story of how she personally decided, you know what? She just woke up one day and she's like, I'm done. I'm done with all of this. I'm gonna get out of addiction. So she got herself into a program, got out of addiction. And right now, this is somebody who was very much in her shell. She's working as a peer worker and she's hosting community activities with other women in her residence, right? So that is like a leap from where she was. And this has taken, let's say, maybe about 3, 4 years, but it's like worlds apart. So even for me, that is like a message of hope because there's sometimes that you're thinking of maybe a project you want to do or something you want to do, and it feels like so overwhelming. But literally, when you see these peers and you look at their story, it just makes you know that you just have to put one foot in front of the other and you get there eventually, right? You just take it one day at a time. Just be consistent and you get there. So that is definitely my story from them. Like I just love that story.
And I completely agree. Thanks for sharing that. But I also can agree with, again, with the line of work that we do. I do get inspired as well with women that I'm working with, or we serve, or walk alongside with. There is just so many touching stories that I have heard ever since I started with Atira, and it is very inspirational, I would say.
Mhm.
So we all uplift each other, women supporting one another. And that's the
Yeah.
whole why, I mean, at least for me, is why here and do the work that we do. Uh, right now, speaking about our crisis, the community, the country, the province, crisis from epidemic and gender-based violence, drug toxicity, and we're talking about economic uncertainty. Amidst of all these challenges, can you maybe demonstrate or share a story moment that really illustrates Atira's impact, especially in the lives of women that we serve?
Yeah. When you say that, the only thing that comes to mind is resources. I feel like Atira, if 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 the phrase "put your money where your mouth is" would define Atira, yes, I would say it actually does define Atira because let's say they get grants, they get the money. I do see that they use it for what they say they're going to use it for. We have so many resources in Atira. So we're providing housing, we're providing safe spaces for these women. There's the harm reduction program, there's the health initiative programs like the vaccine hesitancy program. There are low barrier employment resources as well. There's even the advocacy team. So it is multifaceted just to help the women. And we are not forcing the women to use it, but it's glad to know that women have all these options, right? They don't, it's difficult for a woman to walk up to a support worker in Atira and tell them, oh, this is something I'm going through, and we do not have a resource for that. So that is one thing that I would always champion with Atira, and I would always give Atira that, like, I'll give them a kudos for that, that they have like resources that are geared towards the women and they want to work alongside the women. They're not trying to push it down their throat or make them like make those decisions for them, like, oh, this is what you need to do. But it's great to know that these resources are available, basically.
Hmm. Definitely. The power of connection, community,
Mhm.
resources, and and Atira and the vaccine hesitancy, which is the program initiatives, has been resourceful in that sense. And I've seen that there are upcoming events happening. There are initiatives. What is next for vaccine hesitancy?
Well, one of the literally happening next week, and I'm excited about it, is the art exhibition. So all through the course of the program this year, we've had like art therapy sessions with like a lot of the women, which they've produced some art pieces and even workshops when we've had some workshops. So most of our workshops are always fun workshops. So it's not just about as much as we're educating the women, they're also doing hands-on things. So the art exhibition is just a way to for the women to express throughout the year, like this is what I've done. Like I broke the barriers of feeling like low self-esteem and I'm confident in myself and this is something I was able to make for myself to come see what our women have done. So yeah, I'm excited about that. That's definitely one thing that is coming up right now. And then in the fall season, we always host pop-up clinics in our residence. So we bring the clinics to the ladies in their buildings so that they don't have to go to the pharmacy or like walk down. So for people who have issues with, oh, I have a kid, I can't leave my kid to go get my vaccines, then the support workers are there to help out with that. And then they get their vaccines in their buildings. For people who have like disabilities and that's an issue, then they have like the healthcare workers come to them as well in their residence and they get vaccinated for elderly people as well because Atira has like buildings that is like elderly people who stay there alone. So they don't have the issue of having to transport themselves to a pharmacy or go to the hospital to get vaccinated. So we have pop-up clinics and we work hand in hand with like Fraser Health and Vancouver Coastal as well. So yeah, those are the upcoming things.
That's wonderful.
Yeah.
I love the low barrier aspects of the projects and initiative itself. That it just it's very inclusive,
Mm-hmm.
inclusivity of many areas and in populations such as seniors,
Mm-hmm.
women with children, disabilities, or those who don't have enough information to make that decision for themselves.
Mm-hmm.
So, with that being said, I think that we are working really close together, and I have seen the pop-up clinics events and various initiatives that you guys do throughout the years. Uh, I want us to end this brief session that we had with the message of hope. I know that you work really closely with women at the front, and you see stories that sometimes can be dark. Sometimes it's, as we talked about, very motivational. And it's we all learn from each other, especially from the women that we work with. What is your message today?
Hmm. I would say you can do it. Whatever it is you have in mind to do, you actually can do it. And even if you feel like you can't, we are here to support you. Like Atira is never going to judge you. We're going to work alongside you. So don't feel judged, don't feel condemned. We literally are here for you. Like whatever it is you need, we would hold your hand all through the way and you get there.
Thank you, Chi. Thank you so much. And for all the amazing things and contribution that you are doing for the vaccine hesitancy program and the community as a whole.
Thanks for having me.